Hello and welcome to this explainer. Listen, I am absolutely thrilled to have you here today because we're tackling a topic that affects so many people yet is understood by so few. Today, we're unmasking anxiety disorders. We are going to completely reframe how we look at this condition. For far too long, society has treated anxiety like it's just a personal weakness or some sort of character flaw. But today, we're setting the record straight. We're going to look at the data and the clinical reality to see this for what it truly is, an invisible, highly legitimate battle that people are fighting every single day. Okay, let's dive into this. Have you ever heard someone say this, or maybe you've even had it said directly to you? It's just your personality. You're just a worrier. You're overthinking it. We literally have to stop right here and acknowledge how deeply invalidating this common misconception is. For someone who is suffering in silence, hearing that their intense, agonizing internal struggle is just a quirk of their personality, it's incredibly isolating. It completely dismisses the sheer weight of what they are experiencing on a daily basis. I really want to emphatically validate the reality of anyone who has experienced this. The absolute truth, completely grounded in psychiatric medicine, is that an anxiety disorder is not a personality flaw. No way. It is a very real, physical misfiring of your brain's danger sensors. Imagine the fire alarm in your house going off at absolute maximum volume, but there's no fire. Your body reacts exactly as if you're in mortal danger, but you're literally just sitting at your desk. That is a malfunction of an alarm system, not a weakness of character.
And this alarm malfunction doesn't just look one way either. It manifests primarily across four main types of anxiety disorders. We've got social anxiety disorder, where the alarm triggers intense fear of judgment in social situations; panic disorder, which is characterized by sudden, overwhelming attacks; generalized anxiety disorder, where this chronic, heavy blanket of worry just covers absolutely everything; and OCD, obsessive-compulsive disorder, where the brain basically gets stuck on distressing thoughts and rituals. So it's four different battlegrounds, but they all stem from that exact same malfunctioning alarm system.
So how do we actually define this medically? An anxiety disorder is strong, uncontrollable anxiety or fear, lasting long-term and severely impacting daily life. I really want to highlight the key difference here between just normal worry and a clinical disorder. We all worry about big presentations or paying bills, right? But a disorder means a complete loss of control. It's when that fear completely dictates your choices, exhausts your body, and takes a really heavy toll on your daily functioning.
To truly understand this, we are going to walk through a structured roadmap of 5 core symptoms today. 1. Mienai tatakai, the invisible struggle. 2. Kokoro ena damage, the mental toll. 3. Kaihi kodo toyu wana, the avoidance trap. 4. Karere damage, the physical toll. And 5. Kaifukohi eno michinori, the path to recovery.
Section 1. Mienai tatakai, the invisible struggle. Why it's so hard for others to see.
We really need to understand why this intense, burning suffering is so often completely missed by friends, family, and coworkers. This invisibility comes from a perfect storm of camouflage and avoidance. First off, the symptoms often mimic everyday worry on the surface, making them super hard for an outsider to distinguish. Second, patients actively avoid the situations that trigger their alarms, meaning you rarely ever see them when they're at their worst. And third, because of the very real fear of being judged or told they're just worrying too much, they actively hide it. They mask up. This leaves the person fighting a brutal internal war that, to the rest of the world, just looks completely fine.
Section 2. Kokoro eno dameji, the mental toll. Anxiety attacks and chronic dread.
Now, what's really interesting about this slide is how it highlights the lingering damage. A panic attack itself is absolute autonomic chaos. Sudden terror, your heart is pounding out of your chest, and you might even feel completely detached from reality. But the real lingering torture? It's the anticipatory anxiety. The trauma of a single attack leaves a ghost behind. The patient lives in constant, agonizing fear of when the next attack is going to strike. So they're haunted long after the physical symptoms have actually faded.
And honestly, even without those sudden attacks, there's the chronic tension. Just imagine the agony of a brain whose alarm system never, ever shuts off. You're locked in this constant fight-or-flight mode. You literally cannot relax. You become hyper-reactive to trivial things, a dropped pen, an unexpected email. And this leads straight into catastrophic thinking, where your brain immediately jumps to the absolute worst-case scenario. This chronic dread just drains a person, leaving them hypervigilant and entirely unable to sleep or concentrate.
Section 3. Kaihi shindo toyu trap, the avoidance trap. The short-term fix that shrinks your world.
And this brilliantly illustrates the paradox of avoidance. Avoidance is actually a completely logical, desperate coping mechanism when you're terrified.
But it totally backfires and creates a trap. In the short term, you dodge a triggering situation like a crowded train or a party, and your anxiety drops. Phew, it feels like massive relief. Your brain processes this as a reward. But in the long term, because you never teach your brain that the train was actually safe, the fear just grows stronger. You start avoiding more and more things, basically building a prison of isolation, where your world just gets smaller and smaller.
So how do we break out of this trap without completely overwhelming a hypersensitive nervous system? Well, here is a highly actionable 3-step medical checklist. Step 1. Establish a baseline using prescribed SSRI medications to lower the brain's overall alarm sensitivity. Step 2. Carry PRN, that's immediate, as-needed medication, like a safety charm in your pocket. Just knowing it's there provides immense psychological comfort. And step 3, once you're stabilized, practice gradual desensitization. You take tiny, step-by-step exposures to what you fear, slowly taking your life back.
Section 4. Karada no damage, the physical toll, illness and extreme fatigue. So we've talked a lot about the mental strain of a broken alarm system, but we absolutely must validate that this internal war inevitably ravages the physical body as well. If you are watching this and experiencing physical pain from anxiety, I want to firmly validate that what you are feeling is real. It is not in your head. The chaos in your autonomic nervous system produces real physiological reactions: unexplained headaches, extreme dizziness, sudden sweating, and chronic sleep disturbances. And honestly, perhaps the most painful symptom of all is sitting in a doctor's office, feeling awful, only to be told, "We can't find anything wrong, it's just your imagination."
Which brings us to extreme, crushing fatigue. This is a profound tragedy of the condition. You can experience total energy depletion without doing any physical activity at all. Why? Because your muscles are constantly stiff and your brain is in overdrive, burning through all your energy just by existing in a state of high alert. This causes a severe drop in willpower for even basic work or chores, which naturally pushes the person further toward isolation and carries a very, very high risk of developing comorbid depression.
To handle these physical flare-ups, we use a structured approach. First things first, always rule out other physical illnesses medically. Don't just assume. But once you have that clean bill of physical health, step 2 is absolutely crucial. Recognize that these symptoms are your nervous system reacting to anxiety. Step 3 is the action. Actively shift your focus. Do not obsess over the physical sensations, because monitoring your heartbeat or your dizziness only feeds that broken alarm system. Shift your attention instead to a hobby, a conversation, or a task.
Let's move to and see how this builds into our final section. Section 5, Hoifuku e no Michinori, the path to recovery, turning off the false alarm.
After everything we've uncovered today, it's time to look at the actionable, hopeful conclusion. The roadmap to healing really relies on 2 universal, proven pillars. On the medical side, this means using SSRIs to fix the brain's base alarm level, keeping emergency meds on hand for safety, and treating the root cause to restore your physical energy. And on the behavioral side, it means using gradual desensitization to face your triggers, utilizing relaxation techniques like deep breathing, and pacing your activities so you don't burn out. It's a dual approach, really: calm the brain chemically and retrain it behaviorally.
So the crucial point is this: anxiety disorders are absolutely not a reflection of who you are. They are a reflection of an alarm system that needs recalibrating. The invisible struggle is real, the mental and physical tolls are profound, and yeah, that avoidance trap is super cunning. But the path to recovery is paved with proven medical and behavioral tools. Your brain's alarm might be ringing right now, but are you ready to learn how to turn it off? Thank you so much for joining me in this explainer today, and I'll catch you next time.